If you're just joining us this morning, at least one new COVID case has been confirmed overnight, and we have a press release now from the Ministry of Health. The problem with this case is that they were at the North Shore Hospital earlier in the week for an unrelated illness, and they have now had to close, the Ministry of Health has had to close parts of the hospital while testing is undertaken. They say people needing emergency care are being diverted from Auckland's North Shore Hospital and short stay surgical unit from this morning, this following the positive case I've just described to you. There'll be more detail at 1 p.m, but of course we do have Dr. Aisha Verrall, the Associate Health Minister, moments away now. Ashley Bloomfield says they needed to take this action and they needed to take it swiftly. Given the incubation period of the virus, the DHB has assumed that the person could have been infectious during the admission to North Shore Hospital, hence the need to shut it down. Well, I mean, they're not kicking people out, but everyone who is currently there is being tested, and no urgent cases will be admitted from this morning.
And staff will be stood down, and that area will be deep cleaned today, and they'll hope to open it as soon as possible.
All right, it's just gone now 10 minutes after 7. Here to tell us more is the Associate Minister of Health, Dr. Aisha Verrall. Good morning to you.
Good morning.
Are you aware of any other new cases this morning other than the one we've just been made aware of?
No, that's one. News of that one came through to me. It came through, I think, at 2 in the morning, and clearly there's action underway to make sure that the case is appropriately managed at Waitakere Hospital, and also making sure that we go back and take appropriate action at North Shore in case the case was infectious while there.
Is he okay?
Look, I don't have an update on the young man's clinical situation.
Is he linked to the current cluster that we've been talking about?
That's the important work that will happen today, trying to link him either to one of the cases we already know about or to any of those locations of interest. As I said, the case just diagnosed in the early hours of the morning, so the contact tracing interviews will happen today.
Can you guarantee the safety of Aucklanders, given the stretch that we know was already on with some of our emergency departments and our ICU units, now that we've taken North Shore hospitals offline?
So the hospital will be able to give the local community advice on where to go for care, and while the hospital is not receiving new patients, they will be diverting patients who need hospital care to other hospitals. There will be arrangements in place, and news of that will come through very shortly from the hospital. I think the important thing to know is this is a serious illness. That's why we've had to go to level 4 and to manage the threat of the Delta outbreak, and it does mean that we have to use our health resources really carefully, as we are doing now.
Absolutely. I guess what I'm asking, Dr. Verrall, is there room at the other hospitals for the potential influx of cases that we might see, and also just general illnesses in the community?
Yeah. We know from around the world that any health system with a large outbreak will struggle, which is why we need to take the really proactive public health action that we have with the lockdown to keep everybody safe. But I think the thing is, every hospital in New Zealand has a plan, a contingency plan for what to do if they get increasing numbers of cases due to COVID, flu or mass casualty events, and that includes diverting resources from electives usually to allow acute cases to be looked after.
Yeah, I guess it doesn't really answer the question. I'm sorry, Dr. Verrall. I'm just asking, are there enough beds for people? Because people are worried about this, and Dr. John Bonning, in a story for Newshub last night, the emergency medicine physician, said that the situation was quite dire as it is pre-COVID. Are there enough beds for people?
Yeah, there are, but it means that we have to be very careful about how we allocate resources. And of course, we very reluctantly have to. We don't want to allocate resources away from things like elective surgery. But if there is a need for it, that's how we manage acute demand.
All right. Can we talk about the testing stations? Because we've heard from people. In fact, the owners of Passion Bakery in Birkdale were waiting 9 hours yesterday. So they're a location of interest. There was a positive case in their establishment. They waited 9 hours to get a test, couldn't get one. What's your message to them?
Look,
one of them has flu-like symptoms.
I'm sorry to hear that, and I think I just want to say thank you to the people who who were patient and waiting for what I know was a long time in some cases to get tested. I think we're likely to see on the statistics that yesterday was one of the largest day for testing that we've had in Auckland, and there was pressures. In a sense, that reflects the hard work being done by the contact tracers, which has forced a lot of demand through into the testing system. We have put on more testing sites. That's available on the Ministry of Health website. But I do want to also make this plea that we want those testing resources for people who are contacts, for people who have symptoms, people who have been to locations of interest. If you're not in one of those categories, you don't need to be in the queue, and it's important that those resources are available for those who are at the highest risk.
Is that your sense of it, that there are people joining the queue that are just anxious but not sick or a contact?
Look, it's an anxious time, but we want to make sure that the people going through are those who have been at locations of interest, symptomatic or a contact.
How many more testing stations are you putting up today?
Look, I know there was definitely a couple that I heard about yesterday, but look, I don't have the precise details of which ones.
Do you know the
which
capacity?
Additional ones they are?
Do you know the capacity of them or where they are? Because people are again lining up this morning already around Auckland. They're in their cars and they are packing lunch.
Look, I think it is a good idea to bring some water and something to eat. But look, take the information from the Ministry of Health website about where to go for testing. You can also call your general practitioner to see if they're doing testing.
All right. Minister, I want to talk about the contact tracing because it's vital, as we are all aware now, it's vital to our response to this. So how many close contacts have we identified so far?
Yeah, the update I got last night was was over 600, but I think that number will grow as we have some of those locations of interest come through in the data today. We'll have a full update for that in the afternoon.
Sorry, Minister, I missed the number. There was someone talking in my ear.
So last night it was 600.
600, okay. And do you know how many of those 600 we have contacted?
Yeah, so those details will come through to me tonight. Will be coming through today.
Okay, so we're not sure if we've got hold of all these people or not. Do you know how many from
what
day
we do
one
know is that
we've contacted by day 2?
So what we do know is that we have a really high rate of completion for the known contacts that are people identified by each case and said, yeah, I was with him or with her. Those people have been identified to a high rate of completion, like 100%.
Okay. All right, Minister, a lot of confusion, it seems, in some communities, and not all, but some communities, about our vaccination centres. How many centres are open at the moment? How many are closed?
Yeah, so we've had to move to doing the vaccination campaign at level 4, and from over the last day and ongoing, we're ramping up to full capacity. So I think yesterday we were shooting for about 30% capacity, but actually got to 50%, and we'll get up to full capacity over the next couple of days. So if people have had a vaccine booking and they have not been told by phone or email or text not to come, that means your booking stands, and just go.
Okay, that happened to Jim, a 62-year-old who got in contact with Newshub, who heard nothing. In fact, he got a text yesterday confirming his appointment would still take place at 8:30 in the morning. He drives to the vaccination centre. It was closed, and he's now told it won't open till Saturday. He's got to rebook. Could be weeks before he gets the vaccine. I mean, there's confusion in the community. Can you tell us the number of vaccination centres that are open right now, and the date at which, or the time at which, we'll get to 100%, so that these people will have some surety?
Yeah, so I can't tell you the precise number, though officials have that detail, but like I said, we're aiming in a couple of days to have all of those centres back open and to be functioning at 100%.
Why aren't they functioning at 100%
just,
now?
With respect to that gentleman, I'm very sorry about that situation. It's not right, but I do want to point out we vaccinated over 20,000 people yesterday, so that can't be a widespread occurrence.
Okay. It is a shame because he's got an underlying health condition as well, which, as we know, you don't want to be leaving your house too much at a time like this. How many vaccines do we have at the moment in the country?
Yeah, the stock at the moment is about 600,000 vaccines. We obviously, when we hit those 50,000, we were at 55,000 doses a day just before the lockdown, and that's where we plan to ramp back up to. So clearly, while it sounds like a lot, that's actually, we can get through that very quickly.
So 600,000 doses, that's like first dose or second dose, or are they all the same?
They are the same, so that's enough for 2 doses for 300,000 people.
300,000 people. When's the next shipment coming, do you know? Because people are interested, obviously people are wanting to get vaccinated quickly, and there's a huge incentive with Delta in the community. When's the next shipment coming?
Shipments come about every week at the moment.
Okay. I guess my question to you when it comes to how many of us are vaccinated, because by my calculations, 60% of us have no protection. That's 2.4 million people. And 77% of eligible people are without full protection. That's about 3 million people. When will all of these people, if they all want to be vaccinated, by which date will they be vaccinated?
So we're sticking to our plan of vaccinating, being able to offer everyone who wants a vaccine this year, during the course of this year. What we are doing in light of the Delta variant is making sure that we offer people the new increased spacing between the vaccine. That increases the number of people who can have their first dose and get some protection.
All right, Minister, we really appreciate your time this morning. We really appreciate you coming on the program to explain the situation. I know there is a lot going on, so your time and your answers really appreciated. Thank you so much to Associate Minister of Health, Dr. Aisha Verrill.